heart of Baltimore, men and women wake up every day with no place to call home, no safe space to lay their heads, and no refuge from the challenges life has thrown their way. These aren't just numbers on a report. They are our neighbors, our fellow citizens. For many, the road to homelessness begins with misfortune, illness, or loss, a path that any one of us could find ourselves on. As the crisis continues to worsen, one question lingers. When did we stop seeing them as people? As a society, how much longer will we stand by and let this suffering continue without taking action? Baltimore, once a symbol of industrial success, now faces a growing homelessness crisis that mirrors the larger struggle across America. According to the 2024 Annual Homeless Assessment Report, over 3,400 people in Baltimore lack shelter each night. Among them are veterans, families, seniors, and those struggling with addiction or mental health challenges. The streets of downtown, where shelters are overwhelmed, paint a grim picture. Tents line the sidewalks, and makeshift encampments sprawl across public spaces, standing as painful reminders of a system that's failing its most vulnerable. Take Maria's story, for example. A single mother who lost her retail job during the pandemic, Maria couldn't keep up with rent and was evicted from her West Baltimore apartment. For months, she and her 2 children bounced between overcrowded shelters and temporary housing, their lives spiraling out of control through no fault of their own. Maria's experience is all too common. Many of Baltimore's homeless once had stable lives, jobs, and homes, only to be undone by economic hardship, rising rents, or personal struggles. Since 2020, the city's homelessness rate has jumped by 15%, driven by systemic issues that force people to the edges of society. But beyond the statistics is a human tragedy. Every person experiencing homelessness represents a life disrupted, a future postponed. The stories of a veteran dealing with PTSD, a retiree priced out of housing, or a young person struggling with addiction reveal the deep complexity of the crisis. This isn't just a Baltimore problem, it's a national issue, a symptom of economic and social failures that leave millions without a safety net. Why, in a country as prosperous as ours, do so many have to live without a home? Solving this crisis requires more than temporary solutions. It demands a long-term commitment to understanding the root causes and implementing systemic changes that restore dignity and opportunity for all. To truly understand the homelessness crisis in Baltimore, we need to dig deeper into the complex causes behind it, economic, social, and systemic failures that are all at play. At the core of the problem is the severe shortage of affordable housing. In Baltimore, the average rent for a 1-bedroom apartment exceeds $1,600 per month. Meanwhile, the median income for low-wage workers is just $25,000 a year based on 2024 city data. This glaring gap, made worse by gentrification, has turned once affordable neighborhoods into exclusive areas for higher income residents. Longtime Baltimore residents who can no longer afford the skyrocketing rents are facing eviction, with many slipping into homelessness. The National Low Income Housing Coalition highlights this as a national crisis. No state in the U.S. offers a minimum wage worker enough to afford a market-rate 2-bedroom apartment. This unaffordability is a key driver of homelessness, pushing more and more people to the brink. But housing is only part of the issue. Addiction and mental health challenges are critical factors as well. In Baltimore, about 35% of the homeless population struggles with substance abuse, with opioids like fentanyl driving a devastating epidemic. Mental health disorders, including depression, anxiety, and PTSD, are just as widespread, affecting many people without shelter. However, access to treatment remains limited. Health reports from the city show that only 30% of those who need addiction or mental health services actually receive them, leaving many stuck in a cycle of despair. Without proper support, securing stable housing or finding a job becomes nearly impossible, which only deepens the homelessness crisis. Economic instability also plays a major role. Baltimore's economy, once supported by strong manufacturing jobs, has shifted toward low-wage, unstable work in retail and the gig economy. For individuals with limited education or criminal records, finding steady employment can be a huge obstacle. A 2024 study from the University of Baltimore found that 45% of the city's homeless population cited job loss as a major factor in their situation. With the high cost of living, the loss of income can unravel a family's stability in a matter of months. In fact, just one missed paycheck can lead to eviction, especially when rent takes up over half of a household's income. Social and political factors also contribute. Public investment in social safety nets is insufficient, and federal and state funding for affordable housing and social services has failed to keep up with demand. In Baltimore, public housing waitlists stretch for years, and subsidies reach only a small fraction of those who need them. On top of that, systemic inequalities, such as discriminatory hiring practices and barriers to health care, disproportionately affect marginalized communities who make up a significant portion of the homeless population. These interconnected issues, housing shortages, untreated addiction and mental health struggles, economic insecurity, and inadequate policy responses, create a vicious cycle that locks people into homelessness. Solving this crisis requires more than just acknowledgement. It demands bold, coordinated solutions to tackle these root causes head-on. How can a city or a nation justify such systemic failures when the resources to fix them are available? The homelessness crisis in Baltimore extends far beyond those living on the streets, reshaping the city's social fabric, economy, and political climate. Public spaces, from busy downtown areas to neighborhood parks, bear the strain as unsheltered individuals seek refuge where shelters cannot accommodate them. According to city data, Baltimore's primary shelters, which are designed to serve 1,900 people each night, are consistently operating at full capacity, leaving hundreds to sleep in alleyways or vacant lots. As a result, local residents and shop owners are growing increasingly concerned about safety, litter, and the declining appeal of commercial districts. These issues impact foot traffic and, ultimately, business revenue. The public health implications are just as severe. Without stable housing, individuals face heightened risks of chronic conditions, mental health crises, and infectious diseases. Take Sarah, a 5-year-old woman who has been homeless for 18 months. She struggles with untreated hypertension and anxiety. "I can't get regular care," she shares. "It's hard to stay healthy out here." Sarah's experience reflects a broader trend. Baltimore's hospitals have seen a 25% increase in emergency visits from homeless individuals since 2020, costing the city an estimated $10 million annually in uncompensated care. Poor access to sanitation fuels the spread of illnesses like MRSA, which can easily move beyond the homeless population, posing a threat to public health. Politically, the homelessness crisis sparks heated debates in Baltimore. Some residents demand stricter measures, such as bans on loitering or encampments, arguing these policies will help maintain neighborhood standards. However, these measures often displace vulnerable individuals to less visible, more dangerous areas, further hindering access to crucial services. Others call for more investment in rehabilitation and housing, but budget constraints limit progress. Baltimore allocated just $18 million for homeless services in 2024. The stigma surrounding homelessness, often viewed as a personal failure rather than a systemic issue, deepens divisions, making it difficult to reach a consensus. How can Baltimore reconcile the concerns of its housed citizens with the pressing needs of its homeless population? Economically, the crisis places a heavy burden on the city and stifles growth. Businesses near encampments report reduced customer visits, with some estimating a 15% drop in revenue, according to a 2024 local commerce survey. Meanwhile, the city's infrastructure is strained, as public spaces used as makeshift shelters require ongoing maintenance. These challenges highlight the interconnected costs of homelessness, which impact not only those on the streets, but the entire community. Addressing this crisis requires a balanced approach, one that blends compassion with practicality, ensuring that Baltimore remains a vibrant and inclusive city for everyone. Baltimore is putting in significant effort to tackle its homelessness crisis, but progress is hindered by limited resources and systemic challenges. The city's shelter network provides beds, meals, and basic services, housing over 1,700 people every night. Yet, with demand consistently outpacing availability, hundreds are left to sleep in parks or alleyways. How can a city provide safety when so many are turned away? To address long-term solutions, Baltimore has adopted Housing First initiatives, which offer permanent homes without preconditions, alongside support like mental health counseling and job training. Since 2021, these programs have housed 1,600 individuals, and 82% of them have maintained stable housing after 18 months, according to city records. What can your community learn from this approach? Outreach efforts are also a crucial part of the solution. Mobile teams of social workers and healthcare providers distribute food, clothing, and medical care to those living on the streets. Groups like Helping Up Mission serve over 4,500 individuals annually, building trust to connect people with housing and recovery services. These teams are essential for reaching out to those hesitant to accept help due to past trauma or distrust. Have you ever considered the barriers that prevent people from accepting aid? Prevention programs are another key component. These initiatives offer emergency rent assistance and legal aid to help keep families in their homes. In 2024 alone, these programs helped save 700 households from eviction, playing a critical role in reducing the number of people falling into homelessness as rents continue to soar. Innovative partnerships are also making a difference. Baltimore has joined forces with nonprofits and local businesses to fund job training, giving individuals the skills they need for stable employment. A 2023 pilot program placed 250 formerly homeless people in jobs, ranging from retail to construction. In addition, rapid rehousing programs provide short-term subsidies to quickly move people into permanent housing. While these efforts show promise, a $20 million funding gap, as reported by local advocates, limits their reach. How might businesses in your community contribute to such programs? Despite these efforts, the gap between need and resources remains significant. Baltimore's homelessness programs are funded with a $22 million annual budget, far less than the $85 million experts say is required to address the crisis comprehensively. Coordination between agencies is improving, but many still struggle with fragmented services. While these initiatives reflect Baltimore's determination to address homelessness, they underscore the urgent need for greater investment and collaboration. What innovative solutions could Baltimore adopt to close this gap? Share your thoughts in the comments. By strengthening and expanding these efforts, Baltimore can move closer to a future where everyone has a home. Tackling homelessness in Baltimore requires addressing a complex web of systemic issues, from housing shortages to societal attitudes. At the forefront is the lack of affordable housing. The city is estimated to need 10,000 additional low-income housing units to meet demand, but only 1,000 have been built in the last 5 years, according to the Baltimore Housing Authority. Gentrification continues to push residents out, and public housing waitlists stretch for years. Without bold action, this gap will only continue to grow. Mental health and addiction services also remain critically underfunded. Baltimore has just 200 treatment beds for over 1,000 homeless individuals struggling with addiction, and mental health services reach only a small fraction of those in need. The opioid crisis, especially the spread of fentanyl, has worsened this challenge, with overdose deaths among the homeless rising by 25% since 2021. Expanding treatment capacity is vital, but budget constraints limit progress. Social stigma adds another significant hurdle. Homeless individuals are often unfairly labeled as lazy or dangerous, which leads to policies that criminalize rather than rehabilitate them. Laws banning public sleeping or loitering only push people into hidden corners, making it harder for them to access help. Shifting public perception toward compassion and understanding is essential for creating meaningful change. What would it take to move from judgment to solutions that uplift rather than marginalize? To address these challenges, Baltimore could learn from successful models in other cities. For example, Minneapolis built 5,000 affordable housing units in 3 years by increasing property taxes on high-value developments, an approach Baltimore could adopt to fund 2,000 new units annually. Seattle's job training programs have placed 600 homeless individuals into stable employment since 2022, offering a blueprint for workforce integration. Expanding addiction treatment, like Los Angeles did by doubling its rehab capacity, could also help. A coordinated effort between government, nonprofits, and private sectors is essential to scaling these solutions. By investing in housing, healthcare, and jobs, Baltimore can break the cycle of homelessness. Walking through Baltimore, from the bustling inner harbor to the quiet alleys where tents line the sidewalks, the human cost of homelessness is undeniable. These are not just statistics, but our neighbors, people like Maria, a single mother struggling to keep her family together, or James, desperate for basic medical care. Homelessness in America is not merely the result of poor policy. It is a moral failing, exposing a society that has let too many slip through the cracks, abandoned to a world that often looks the other way. This crisis forces us to confront our deepest values. If we truly believe in justice and empathy, how can we accept a reality where millions are left without shelter? The stories of Baltimore's homeless are more than just accounts of hardship. They're a clarion call for systemic change. We must push for policies that address the root causes. Baltimore needs 10,000 affordable housing units to meet demand, yet only a fraction are built each year. Mental health and addiction services are essential, with only 200 treatment beds available for more than 1,000 people in need. Stable jobs, like those created in Seattle's programs, which have placed 600 formerly homeless individuals into stable employment, offer a path forward. These are not lofty ideals, they are necessities for breaking the cycle of homelessness. Our nation has the resources to end this crisis. The question is whether we have the will to act. What kind of society do we want? One that lifts up its most vulnerable, or one that turns its back? The answer lies in the choices we make, the policies we champion, and the compassion we show. Baltimore streets reflect not only a local struggle, but a national test of our resolve. We cannot ignore the faces behind the statistics, the lives yearning for stability. By demanding affordable housing, better health care, and economic opportunities, we can create a future where everyone has a home. Let's act now to ensure that no one is left behind in a country capable of so much more. Conclusion. The homelessness crisis in Baltimore is a stark reminder of the broader struggle of homelessness in America. It's a crisis deeply rooted in systemic inequities, unaffordable housing, inadequate health care, and economic instability, issues that demand more than temporary fixes. While Baltimore's efforts, from shelters to prevention programs, are admirable, they remain insufficient without greater investment and coordination. The path forward requires bold policies, building thousands of affordable homes, expanding treatment for addiction and mental health, and creating job opportunities for those on the margins. This isn't just Baltimore's fight. It's a national challenge that calls on all of us to take action. What can we do to ensure that everyone has a place to call home? Share your thoughts in the comments. The time for change is now, and it begins with us.